everyone, and welcome to the 2025 Empowering Health webinar series. This series will explore the intersection of health and technology, diving into the tools, challenges, and breakthroughs that are shaping how we care for ourselves and our communities. My name is Nerese Millette-Williams, and I'm the project coordinator for the University of Maryland Extension Marylanders Online program. And this event is brought to you by the University of Maryland Extension in partnership with the College of Information and in collaboration with our Family and Consumer Sciences. We have a great session planned for you all today, and we're so glad that you're here to be a part of it. So before we get started, I wanted to state that all university programs, activities, and facilities are available to all without regard to race, color, sex, gender identity, or expression, sexual orientation, marital status, age, national origin, political affiliation, physical or mental disability, religion, protected veteran status, genetic information, personal appearance, or any other legally protected class. Additionally, please see the following slide that includes QR codes for our speakers today, which you can view on our website, completing the conference survey after the end of the session, and registering for our last webinar series, which is tomorrow at 11. And you can also find these QR codes on our website or on your program agenda that was sent to you by email. So today we're excited to be joined by Xingman and Dr. Becca Beets to discuss social media's impact on public health and spread of health misinformation. Xingman Wu is a PhD candidate in the Department of Communication at the University of Maryland. Her research centers on human-computer interaction, persuasion, and health communication. She currently serves as a research assistant at the Center for Health and Risk Communication. Dr. Becca Beets is an assistant professor of Science Communication in the Department of Communication at the University of Maryland. With a background at the intersection of science, communication, and policy, her research focuses on emerging science and technology, particularly public opinion, engagement, and new media. She holds a PhD in mass communications from the University of Wisconsin and an MS in science, technology, and environmental policy from the University of Minnesota. It's an honor to have them here with us today. Please welcome Dr. Becca Beets and Xingman Wu.
Hi, everyone. So I'm going to kick things off for this and then pass it over. So give me 1 second, share my slide. All right, is everyone able to see slides? Good. Okay, so thank you, Nerese, for that introduction. It's very exciting to be here. I have spent a lot of time thinking about misinformation recently. As Nerese mentioned, I teach science communication. I research about science communication, thinking about all of the different ways that emerging science, emerging health issues can impact public opinion and things like that. And of course, misinformation is a very large part of that, and it's been a big part of the conversation recently. So just to kind of give you a sense of what I'm going to be talking about. So for the first part of this talk today, I'm going to just kind of give you what I think about when I think about what health misinformation or science misinformation is, and then give a little bit of context for some of the changes in our media environment and how that has helped to contribute to the spread that we're seeing of a lot of public health related misinformation on social media. And then I'm going to kick things over to Xingman, who is going to talk more about impacts and intervention strategies. So I think we're all probably pretty familiar with different examples of misinformation that we've seen, but these are just a few, that have come up recently, things related to misinformation around raw milk and concerns about people consuming raw milk, misinformation related to measles and measles vaccines. On things like TikTok, there have been a lot of things related to wellness, as well as things like ADHD. And then, of course, there has also been some misinformation around birth control and things like that. There are so many different examples and ways that these things intersect with public health, but these are just a few, and they've all had sort of different impacts. And then, of course, much of this is really grounded in what we saw over the past 5 years related to COVID-19. So One of the things that I think is important when we're talking about misinformation is to understand what do we mean. And this is actually something, as someone who researches in this space, that experts don't necessarily agree on a strict definition of what misinformation is, especially if we're thinking about it in health and science versus maybe public policy, political misinformation, those realms. So this is just a study that was done a couple of years ago with 150 researchers who study misinformation and asking them about what they viewed as misinformation. And the most common definition was just false and misleading information, which is great. But for our purposes, I think that that is sort of a broad definition that isn't necessarily as useful when we think about science and health contexts, especially because we know working in health and science spaces that scientific evidence is always subject to change, things like that.
Oh, sorry to interrupt. I
Yeah.
think the slides has some problem, like it cannot show the whole screen of it.
Oh, no. Okay. Hold
Oh,
on. Sorry.
no.
Okay. Hold on 1 second. Let me do it again. That better?
No, it's still, I don't know why, but you only show parts of it.
Hmm. Okay. Let me try one more thing. Apologies.
Or
Weird.
maybe we can use the presenter view, not the. Oh, yeah, it's better.
Better? Okay, hold on.
Yeah.
Let me just do this.
That looks good.
That's good?
Yeah.
Okay. Sorry. My bad. I can't read the chat while I'm talking, so
Yeah. No, it was just a
thank you
little
for
cut off
raising
on
your hand.
the right side a little bit, but
Oh, okay. All right. So starting back with, so when we're thinking about defining like misinformation in the context of science and health, I think one of the really important things is this idea that um, it's information that is inconsistent with the weight of accepted scientific evidence at the time. And this recognizes that science and health evidence is subject to change. It also recognizes the role of science experts, health professionals in kind of creating this sphere of what is misinformation. But of course, this comes with some challenges that we've likely seen over the past few years. What happens when experts disagree in terms of what the state of accepted scientific evidence is? That becomes particularly tricky with emerging public health crises where the evidence is moving really fast. Um, and what happens if there's no evidence or it's unsubstantiated claims? And we see lots of examples of this online, especially in health and wellness spaces, on TikTok, on Instagram, claims about, supplements doing all of these magical healing things for you. And one of the things that we see is that a lot of these are claims that just really aren't backed by any evidence. So the question is this misinformation? Is it not? Some people would argue it doesn't really matter. It's still misleading. So the other thing to kind of distinguish between is misinformation and disinformation. And really the only difference here is that disinformation is information that is intended to mislead. So we can accidentally spread misinformation, not realizing it's false. However, disinformation is intentional. One of the challenges, though, of course, is it's really hard to prove intention. We don't necessarily know when something has been intentionally spread. However, recently with examples of deepfake videos and things like that, it becomes easier to see, really targeted, false and misleading information that has been put out into our environment. And then the final piece of this that I think is important, especially when we're talking about health topics, is this idea of misperceptions, which very simplistically, it's just a belief in information that is false. For example, if someone were to believe that you could get the flu vaccine from the flu or get COVID-19 from the COVID vaccines, we see a lot of these types of campaigns during flu season, there were a lot of campaigns from public health agencies during the COVID-19 pandemic trying to specifically combat this misinformation. But one of the areas in my research where I see this getting a little bit messy sometimes is when we're talking about things like vaccines. Sometimes people conflate this idea of misperceptions with people's risk perceptions. And I think it's important to understand how those are separate. So you can, feel as though a vaccine is risky. You can feel like maybe you're afraid of needles or have any other reasons to be concerned about side effects. That doesn't necessarily mean that you're misinformed. So I think that's also an important distinction to keep in mind. When we're talking about this landscape of misinformation, it's also useful to recognize that not all misleading content is misinformation. This is from that same survey that they did with the experts, the 150 misinformation researchers, talking about all of these different types of content that are out there, things like clickbait. So really catchy headlines that draw you in, they get you to click on articles, but they're not necessarily reflective of the content of the article. And they're not necessarily misinformation. It's just, a very widely used tactic to get people to click on things. Similar with something like satire. I don't know how many of you are familiar with The Onion, but it is a wonderful satirical news source out there. The problem comes into play when people do not understand that satire is satire. And that can be problematic if people believe things. But you can see, if you look at this chart, when they asked experts, most experts agreed, looking at the kind of dark red part, that they didn't think that things like satire and parody were misinformation. So that's kind of this broad landscape of thinking about what we're talking about. But then the other piece of this is how changes in our media environment have really contributed to what's going on. So this is some data that just came out from the Reuters Digital News Report, and they look at the global landscape around news, news sources, news use in countries around the world. And in particular, I want to draw your attention to the dark blue line. So this is social media. So one of the trends that we've been seeing, of course, is that people increasingly use social media as a source of news. This year, it was 54% of Americans reported using social media for news, which is actually up from 48% last year. So that's actually a pretty substantial jump. And we see trends like this when we ask similar questions about using social media for news, specifically about health and science topics. And this is just to show, this is from that same report, looking at some of the top social media outlets that people are using. So this column here is for news specifically, and then the rightmost column is, how many users use these platforms. And what we see is that things like Facebook and YouTube are actually the most widely used as sources of news in the United States. And building off of this, we also then have this question of, okay, well, if people are going to social media as a source of news, are they trusting what they see, what they encounter on these platforms? And we've also seen, if you look at this kind of yellowish line on this chart, that our trust in social media sites and the content that we see has actually also increased as the use has increased, which is interesting to think about, given kind of the widespread nature of, as we'll talk about, some of the false information that's out there. So thinking about what this means for social media specifically and the spread of misinformation, one of the things that I think is important, and this has been talked about and kind of shown numerous times when studies have looked at who is sharing misinformation on social media. One of the things that is consistently found is that it's actually a small number of very highly active users that are the greatest spreaders of misinformation. So while it may seem like this is something that is widely talked about, widely encountered, it's not really the case necessarily that we have a ton of people out there spreading misinformation. And this isn't specific to health, but this is just in general. And there are a number of different factors that can contribute to the spread. So the next few things I'm gonna talk about are gonna kind of build out of this chart. So this was a study that was done where they just looked at all of these different factors that contributed to how misinformation spreads. And I am gonna focus on the top 3. So source characteristics, which means who is actually sharing the information. Context related factors, where is this information being shared? Is it on TikTok? Is it on YouTube? Is it coming, what are the attributes of those specific channels? And then the last thing is message related factors. So what is it about the actual, tweet or Instagram reel or TikTok video that is going out there that could potentially kind of increase the spread of misinformation? There is so much research that has been done on this last bucket of receiver characteristics, and that means us as the receivers of the misinformation. And I'm happy to talk more about that, but that's a whole other conversation. But that's things like, what is your political ideology? What types of sources do you look at in terms of news? What are your religious beliefs? All of those different things can kind of work in tandem to impact how we both believe and potentially share misinformation. So I want to start with the message-related factors and specifically talking about 2 things. The first thing is multimedia. Hopefully it's not a surprise that multimedia can be very powerful communication tools. They're widely used in health communication contexts, in part because things like visuals, videos, they're very attention grabbing. They can be processed quickly and intuitively. They can evoke emotion when we see those sad images, and we just immediately feel some sort of way about the content that we're seeing. But one of the challenges especially with the rise of AI technology, Photoshop, things like that, is we see that digital media can be very easily manipulated and increasingly convincingly so. So this example that I have here is of a researcher whose likeness was actually taken and put into these sponsored advertisements on Facebook to kind of use her credibility as a researcher. And it was used to sell fake drugs. And users' banking information was actually taken as part of this process. So it's an example where kind of it was very easy to manipulate this image and also kind of use this credibility that comes with being a researcher to basically do nefarious things on the internet. We also, one of the benefits of multimedia is that they can evoke emotion. And we see a lot that misinformation very often uses an emotional appeal. So research in this space has looked at a few things. So when we have increased emotion, so things like being angry can actually increase our belief in misinformation when we're exposed to it, which in turn can lead to more people sharing misinformation online and online spaces. Other studies have looked at how actual misinformation claims increase things like outrage. How outraged do we feel about whatever the issue is, which then in turn can increase sharing. So it's a situation where we as humans, we like emotional content, we like to kind of read it, we like to feel, but that can also have negative impacts if it's the type of content that encourages us to kind of push that information out there in online spaces, which becomes very easy to do. Okay, so moving on to context-related factors. So this is things like our social media platforms. So there are so many different features of social media platforms that will contribute to how misinformation is shared. They're designed to keep us engaged, to keep us hooked, to share this content and pass it along to our friends and our family. things like sharing, being able to tag one another, those really feed into this idea of social reward, social comparison, things that make us feel good to do. Things like read receipts when you send somebody a message can create a type of social pressure that encourages people to re-engage with the platform and see if someone has read their message or respond to messages. I imagine many of us have gotten trapped in the endless scroll loop where you're just sitting there constantly scrolling on your phone. That's intentional. It's designed to not have a cue for you to stop, which means you keep engaging with content, which means it increases the likelihood that you could be exposed to misinformation as you're scrolling through it. And then we have tailored content, and I'm going to talk more about algorithms right now. So things that are really tailored and curated to you as a viewer. So algorithms really shape all of the content that we see. There is sort of the backend algorithm that a platform like YouTube or Facebook or, X uses to determine what type of content you see. And then there are the algorithms that also learn from your behavior. The more you like something, the people you follow, it will then start feeding you content. And I teach a class on misinformation, an undergraduate class. And one of the things that I talked about with my students was how easy it is to actually train your algorithm. If you suddenly want to start, only seeing puppy content on Instagram, you just start following accounts, you start liking things, you don't stop when you see those types of videos. So it becomes easy to manipulate this. But it also, one of the challenges is that we don't know what we're not seeing. So as communication researchers, we think a lot about, have you put yourself into a sort of echo chamber or a filter bubble where you are suddenly only exposed to the viewpoints or the types of content that you see, which means if you are someone who believes a lot of misinformation and those are the types of accounts that you follow that spread those types of claims, you may never really be exposed to truthful claims in your online experience. And the other place related to algorithms where you can kind of spread and get exposed to misinformation is through the search function. There have been several studies that have looked at how when you search, especially during the pandemic, searching for COVID-19 vaccines, for example, you end up with a lot of misinformation in a search feed. And it's not necessarily obvious that that's misinformation in the moment. And then the last thing, with this rise of access to social media platforms and things like that, anyone can create content. So one of the challenges with that is that there's less moderation. We are not talking about journalistic norms where there's norms of practice and how you develop content. There's less oversight in terms of the content that's out there, as well as less moderation. If you explore this is a little Padlet from my class where we've explored things like the policies that Meta uses or TikTok in terms of how they regulate content that's on there, misinformation. Those policies are always changing, and it can be very tricky for these large platforms to actually kind of flag content that potentially contains misinformation. Okay, and then the final thing is thinking about the characteristics of the source. So who is sharing this information? And this is a big one because this landscape has really changed, especially recently when we think about the rise of online influencers. Things like how credible, how trustworthy do you view a person that is sharing this misinformation or this information online? How similar are they to you and your views? There are several examples. We see these all the time with celebrities who will be endorsing certain products and sharing them online. We saw that during the pandemic. Even now, there's all sorts of different examples of this. But there's also been this really intense rise of health and wellness influencers online, especially in spaces like Instagram and TikTok. And what researchers have started to notice is that many of the people who were sharing a lot of misinformation during the pandemic related to COVID and vaccines have started to pivot and share other types of misinformation, things related to birth control, climate change. So one of the questions here is, how could we potentially capitalize on this credibility or role that influencers have and the following that they have to try to promote better health information and less potentially questionable information. So I'm going to end there and pass it over, but I am happy to talk about any of these things in our discussion. Thanks.
Thank you, Dr. Beets. The presentation was amazing. Okay, I'm gonna share my slides. Okay. So for my section, I'm going to cover maybe 3 sections. First, the dangers caused by misinformation on social media. And I'll talk about what we can do to protect ourselves from misinformation and disinformation from the perspectives of companies and also active audiences. At the end, I'll share some resources that we can use to detect misinformation online. Okay, so first, one main danger caused by social media disinformation and misinformation is the direct health harms. We've seen, the misinformation online about vaccines. They talked about the microchips, infertility, and severe side effects. And these information leads to lower vaccination rates, preventable hospitalization, and death. Another thing is about the false treatments. Online promotion of unproven remedies like bleach ingestions, this information leads to the poisonings, serious health complications, and diversion from legitimate medical care. So direct health harm is basically the most direct danger. And of course, erosion of trust. After reading all those misinformation and disinformation on social media, some people, they kind of believe in conspiracy theory. They believe that experts are lying. And during the pandemic, narratives suggested that mainstream media and mainstream media and medical establishments or clothing, fewer than 3 in 10 say that the agency can act independently without being influenced by outside groups. So that number is quite low. And this is the survey conducted in this year, 3 in 10. The impact is people have deep skepticism towards public health guidance, and it undermines scientific consensus. So, of course, the dangers also include the economic harms and the privacy risks. What can we do to handle these dangers? So I'm going to talk about the solutions in the perspective of industry and also active audience. So first, what actions can we take from the perspective of companies? Previously, I've done some research in the field of vaccine hesitancy and misinformation. We mainly focused on how to help the audience combat misinformation online by sending them specific messages. So it's kind of like a content intervention. And one important theory here is inoculation theory. So simply saying inoculation theory is like giving your brain a vaccine against persuasion. Just like vaccine exposes our bodies to a weakened version of a virus, so it can learn to fight off the real thing. Inoculation messages expose you to a weak form of an opposing argument. This helps your mind build up mental antibodies, so like reasons and confidence to define your beliefs when stronger attacks come later. For example, if you believe smoking is harmful and someone gives you a message, like some people might say smoking helps relieve stress, but that's not true. There are healthier ways to manage stress. So they give you a message like this. Your brain practices defining that belief. Later, when someone tries to seriously persuade you that smoking is good, you're more likely to resist it because you've already been vaccinated. Because you've like already been mentally vaccinated against the message. So another example, imagine you were working at a vaccine company and your company just released a new vaccine, and you know that there might be many information online, misinformation online, talking about like the vaccine you just released is not reliable. And what can we do using inoculation theory or this mechanism? We can pre-vaccinate our audience. In other words, the jargon is pre-banking. So it's just basically mentally vaccinate our audience ahead of time before they see misinformation online. So pre-banking is a technique to preempt manipulation online. Pre-banking messages are designed to help people identify and resist manipulative content by forewarning people and equipping them to spot and refute misleading arguments. These messages help viewers gain resilience to being misled in the future. Pre-banking works by first forewarning audiences that they may encounter attempts to manipulate them, like first warning them. And pre-banking messages can take a wide variety of forms. It can be one message, it can be a large campaign, it also can be a short video. Recently, Google held a pre-banking program and they designed some white pages that are already attached here. If you want to learn more about like what is pre-banking, how to do pre-banking, and some case studies, you can visit this website. Okay, so now we already understand the theory and the mechanism of like pre-banking, which is basically mentally vaccinate our audience ahead of time. Then how can we design a message to pre-bank our audience? Okay, how to pre-bank? So still we use the example of vaccine company. You were working at a vaccine company and your company just released a new vaccine. Then you need to design a pre-banking message. So normally the message included 4 steps. 1, warn the audience. So you need to let them know that they will be exposed to misleading or false information. For example, you can say, you may soon see claims online that this vaccine changes your DNA. That's not true. So this is the warning. Second, you expose them a weakened version of the misinformation. You can say, some people might say the vaccine hasn't been tested enough. And then the third step refute the false claim with evidence and logic. You provide facts, explanations, and simple reasonings to counter the claim, to counter the second claim. And this helps people practice how to resist it. So targeting the second claim, like some people might say the vaccine hasn't been tested enough, you can refute it by saying, actually, the vaccine went through all standard testing phases and has been approved by independent experts. So basically, the front three steps, after finishing the front three steps, you just finish the main part of the message. And the fourth one is strengthen resistance through repetition and relevance. Only one message for pre-banking is not enough, like amount wise. Normally we can do it like by using more messages, more pre-banking messages, and improve the personal relevance so that we can strengthen the mental defense. But when we are designing the message, we need to include like the warning, the weakened version of misinformation, and the refutation. Okay. That's how we design the pre-banking messages. Okay. Another effective approach companies can take to combat online misinformation is to shift their communication strategy by using, by employing trusted influencers and community voices instead of only relying their company channels, which might be met with like skepticism. Working with individuals who already have established the trust and credibility within some specific communities can significantly improve the acceptance of the messages. So the influencers can be like local leaders, health professionals, social media influencers. All of them can help conveying accurate information. So here we can try to do a quick quiz. So what kind of influencer would you choose if your vaccine targeting, if your vaccines were targeting college students? So we can choose a college student influencer online. Oh yeah, TikTok. We can choose a college student influencer on TikTok because of what? Studies have already proved that people are more likely to trust and internalize messages from individuals who they perceive as part of their social community. So if your targeting population is college student, you just find another college student influencer so that your target population would believe that what the influencer says is the truth, because they share the same value, background, and identities. So this is another strategy. We can use trusted influencers and community voices. So what can we do as the active audience? Still, we talked about pre-banking, but this time as the active audience, we are not the one who writes messages like the company. This time we need to learn how to protect ourselves by recognizing some strategies in these misinformations. So in misinformation and like disinformation, sometimes they use some strategies, to make people believe in them more deeply. And these strategies are some fallacies, and I included them here. We need to be careful when we see the following fallacies. So first one is emotional language.
You muted yourself.
You're muted.
Sorry. Okay. Emotional language, it contains strong emotional terms, especially those with a negative effects such as fear or outrage. For example, you will be shocked by what your doctor is keeping from you, and what you're about to see will horrify you. These words are really emotional and it can manipulate people. Also, false dichotomy. It presents a limited number of choices or sides as mutually inclusive, when in reality, more options are possible. For example, if you are not with us, you're against us. And you're either part of the solution or part of the problem. Next one, incomplete evidence. It presents a selection of evidence to support a claim while ignoring or omitting evidence that contradicts it. For example, one claim can be the climate has always changed naturally, so there's no need to worry about global warming. However, this statement only highlights historical neutral climate shifts like ice ages, but ignores overwhelming scientific evidence showing that current climate change is kind of driven by human activities. So this is incomplete evidence. About fake experts, are individuals who sound like experts but lack real expertise, often promoting unproven claims or undermining expert consensus using fake but credible sounding institutions. It's not rare, to see these fake experts on TikTok or other online platform. We've seen some influencers wearing a red doctor's coat, giving evidence about brain cancer or other diseases. But we're not sure whether they have a real degree or something like that. So this is about fake experts. Next one, red herring, diverting attention from a real issue by focusing on topic with only a surface relevance to the original. For example, why are you upset? Think of all the starving children around the world who have it worse than you. We need to be skeptical when someone responds to a controversial question by calling attention to another charged or polarized topic without actually answering the original question. So we've seen a lot of these kind of fallacies in misinformation or disinformation online. And here's more. Okay, and scapegoating. It's singling out a person or group and placing unwarranted blame on them for a particular problem. Voters turnout is low because one group refused to go out and vote. This one drastically simplifies a complicated issue by diverting the attention somewhere else. It just redirect attention toward another group or person. And ad hominem attacks are commonly used to redirect the listener away from the subject at hand and towards an individual. It attacks work because once an individual agrees that the holder of the point of view is flaunted, it can become harder for them to agree that their point of view is not. Okay, polarization, it divides into two sharply constructing groups or opinion. I don't trust people from the other team. They're cheating. It's like that. And the last one, decontextualization. It intentionally showing text, audio, or visuals in a different context or removing important background information in order to change its meaning. So it can be a photo of damage from a natural disaster posted with a misleading comment asserting the damage was caused by a recent protest. So it can be a photo of another disease, but people just say it's is caused by vaccine. So these are the fallacies. And when we encounter them in a message, we need to be careful. Okay. Another thing we can do nowadays as an active audience is to use monitoring tool. Nowadays all AI supported tools popped up, and here I listed some of them. And this one is a monitoring tool for written content supported by AI. Journalists, and of course us, we can use this to speed up the fact-checking process. This one is, I paste a screenshot here. So after you type the statement you want to check here, you can get all the information online. It can be supporting evidence, mixed evidence, and disputing evidence. It just lists all the evidence they can found online. And you can see the source of each evidence and the year, the date, and the trust score, and their political bias, whether they're neutral or biased. So this is Factiverse. Another one is Claim Review. Claim Review is a tagging system created in partnership with Google. So it can help identify and promote fact-checked stories to appear prominently on search engines. After you installed it, once you search something, they will give you the claim and the person who claimed that. Okay. Another one is a monitoring tool for images. This one is commonly used by journalists too, but also we can use it to search for duplicates of images. It can track where the image has appeared before and use the reverse searching techniques. So I tried to, this is a screenshot I made, and I found 0 matches because this is what I made. Yeah, and you can use it to track the history of the image. Okay, and I pasted 2 links here. One, AI tools is, it includes all the advanced like AI detector. You can detect misinformation using these tools in text, images, videos even. So if you need it, you can visit this website. And the pre-banking, this is the, I just mentioned about it, is the Google program. So it talks about the essential section of pre-banking, how to pre-bank. So if you want to design a pre-banking message, you can visit this website. And that's basically my part. And thank you. Okay.
All right. Thank you so much for those presentations, Dr. Beets and Xingman. We really appreciate it, and it was very informative with a lot of resources that we can all use. I want to open up the session for any questions. You can feel free to use the chat, raise your hand, or just unmute as well. And it can be for both Dr. Beets and Xingman. And for the name of the first checking tool, it's Factiverse, and we will post these the PDF of both presentations on our website, so you guys will have access to those resources as well. I'll open it up for 1 more minute for any questions. All right, if there are no questions, again, you can let me make sure, check the chat. If you have any questions that come to mind, please feel free to go on our website, or you can scan the bio here to view our presenters' bios on our website, and then also it'll have their contact information. Also, I do see a question here. Can any of those be used on social media? In the presentation, it was mentioned that the tools can be used for articles, images.
Like previously, there was I think it's Bot Sentinel. It's an AI tool that can be used to filter whether the Twitter account is for a real person account or just a chatbot account, like whether it's it's talking about something real or misinformation. However, I think in 2023, if I remember correctly, Twitter kind of stopped the API access from like outside. So I'm not sure whether there's another new tool that we can use nowadays. Yeah. Mm.
Yeah, I'm not aware of anything. And I think one of the challenges is that a lot of social media companies have, because they've started integrating AI content and accounts actively into their own platforms. For example, Instagram, you can follow AI accounts entirely. So they sort of changed the relationship with AI, and also how they are flagging and moderating it, which I think just even further complicates this whole environment. Yeah, so.
Yeah.
And everything's moving so quickly too, which I know is not a helpful answer, but it just increases kind of that challenge in this space.
Yeah. What we can do is to like copy the statement in Twitter that we want to check and to paste it to the detector. And in that way, maybe we can kind of detect it.
All right, thank you for that. We do have another question here. Will this presentation be recorded? Yes, it is recorded, and it will be posted on our Marylanders Online YouTube page, which Julie Slivka added in the chat. Also, the website, I will add the link to the Marylanders Online website where you can find more information about our speakers and their contact information as well. Or if Julie can add the link for our website really quickly. Also, I think we have another question here at the bottom. Okay, here's a question from Bori Ventura. I use TikTok a lot. With the government closing, a lot of government agencies, doctors are going to be the platform to disseminate information that was usually done by those agencies. What recommendations do you have to fact check that content? I know you can use AI, but AI also has errors.
I think, right, so we've seen a lot of this across different platforms of doctors, scientists, experts, basically trying to debunk a lot of the information that's out there or share information in lieu of federal agencies, other places that are no longer able to share that information. I think it's sort of the same rules apply that we would advocate for just general online literacy, is looking at the sources that they're providing, trying to go back to kind of the original reputable places. I realize that becomes challenging if that information is not contained on some of those larger agency websites, but it's still very much about, is it coming from health organizations? Are these doctors who have actual credentials? Because as was mentioned earlier, we have a lot of fake experts online, people claiming to be one thing when they're not, or you have people who have expertise in one area who are suddenly sharing a lot of information in an area well outside of their expertise, which doesn't necessarily mean it's wrong, but it's something that should catch your attention and potentially be a warning sign. So I think that is those sort of logics still apply in these cases for checking content.
Thank you for that. Do we have any final questions for today? Okay. Well, before we officially close, I do want to share a few quick reminders. And thank you again to our speakers for such a thoughtful and engaging presentation. And also a heartfelt thank you to our audience here who have joined us, and your energy, engagement, and your questions, and as well as your commitment to advancing health access and technology is truly appreciated. Really quickly, we have one last session tomorrow. Is it tomorrow? Yes, tomorrow from 11 to 12, Digital Health Technologies and Misinformation, Navigating the Challenges. So if you have not already registered, or if you'd like to share this with your network, please feel free to scan the QR code here, which you can also find on our website or on your program agenda. And that session tomorrow will be a panel. Finally, if you would like to get in touch with our program, Marylanders Online, we do have our website here, marylandersonline.umd.edu. You can also reach us by through our email and our toll-free tech helpline, which we're open from Monday through Friday, 10 a.m. to 8 p.m. and Saturday, 10 a.m. to 5 p.m. We also have social media, which you can scan our link tree here. We have our Facebook, Instagram, LinkedIn, as well as our newsletter. Sign up if you want to find out more about events and conferences that are coming up. And on that note, I would like to say thank you everyone again. Please look out for a follow-up email from Marylanders Online to complete the post-webinar session survey for this session. It's also, the QR code is also on your program agenda, and you can scan it here. And we would like if everyone could please try to complete that survey for this session. So we hope you leave here today feeling more informed and inspired. Take care, and we look forward to seeing you all tomorrow at our last session. Thank you, everyone.
Thanks, everyone.
Thank you.